So we've kind of touched on this on a multitude of segments of this podcast, but straight up, are there things that people can do to prevent vision loss?
Sure. We've talked about it. The number one thing I would say is smoking. Smoking affects every organ in your body, and it certainly affects the eye. Stop smoking green leafy vegetables. We joke around about carrots and Bugs Bunny, but it's true that beta carotene does help the retina. What helps the retina more is antioxidant and free radical damage, and green leafy vegetables are what's best for the eye and what's best for a lot of your body. The retina is very metabolically active, and so we talked about free radical damage, and some of that is environmental, wearing sunglasses, reducing the amount of UV light in the eyes, and some of that comes from inside your body, and being able to fight that free radical damage from the inside. And so having those stores of supplies from your diet is very important. Getting an eye exam early instead of waiting till you have symptoms. One of the things we talked about before was glaucoma that doesn't really have any symptoms. And so the best thing to save your vision would be getting an eye exam and knowing what you're dealing with. I think a lot of patients that we might have, and just humans in general, sometimes don't want to know things until they're really bothered by it. They'll have some kind of small symptom and they'll say, it's okay. It only happens on Thursdays, or it's okay, I can deal with it. So much in medicine, and certainly so much in the eye, is so much easily treated when it's early. And so just knowing being half the battle, I'd encourage everybody to get an eye exam at least every 2 years, perhaps annually, depending on your profile, depending on how old you are and your risk factors. Even if you're not having any symptoms, even if you're 26 years old, you don't need glasses, you don't have any problems, you should still get your eyes checked, because there's still so many things that, one, could be wrong with your eyes, or two, you could find about your body from an eye exam that it's worth checking.
What are some of the things that you can learn about your body through the eye?
Almost everything. The phrase, the window to the soul, the eyes are the window to the soul, right? But the eyes are also the window to the body. We talked about that model about the eyeball, the cornea in the front, the retina in the back, and the optic nerve extending to your brain. If you think about it that way, the optic nerve is an extension of your brain that you can visualize. You can see your optic nerve without cutting you open. You can see sometimes the brain function based on your optic nerve. If someone has a brain tumor, the increased swelling in their brain, that'll show up in their optic nerve because their optic nerve is swollen because of all the pressure in the brain. People can have an infection in the brain that shows up on the optic nerve with hemorrhaging or certain signs on your optic nerve that you can see. If you keep going forward, the retina, that sensor in the camera, that film in the camera, is one of the most vascularized part of your body, and you can see those blood vessels, right? You can have a problem in your heart, you can't exactly see it. You have to do an EKG or an MRI or CT or something to visualize the blood vessels in the heart. For the eyes, you can just dilate the patient and look in their retinas. So when we're dilating your pupils to give you an eye exam, we're not doing that because we're sadists. We're doing that because, one, it's the only way we can see the retina is to dilate your pupils. But it's a very nice way to check on the health of your body as a whole, because I can see the blood vessels in your eyes when I dilate your pupils, and I can see your arteries, and I can see if they have cholesterol in them, and I can see if they have a plaque in them that came from, say, your carotid artery and went up to your eye instead of going to your brain. A stroke is a ischemic damage, or let's say lack of blood flow to your brain, that's typically caused by cholesterol buildup, either in your heart or in your carotid artery in your neck. If a piece of that plaque or a piece of that cholesterol breaks off, it travels upwards. It can go to the brain. It can often go to the eye. And if we see a little bit of plaque or cholesterol in the eye, we worry that this patient had some of that break off from his heart or his carotid artery, and he's at risk for a stroke. And so we can catch that in the eye. and make sure that patient is properly managed to prevent strokes or to prevent future strokes. You can have a stroke in the eye. Sometimes that cholesterol that I mentioned hits the eye, blocks off any blood flow to the retina and causes a huge blind spot in the vision. But you can argue that's kind of a good thing to happen because maybe it landed in the eye as opposed to landing in the brain or the part of your brain that controls your breathing, and that's a stroke, and that could be fatal. Diabetes can show up in the eyes first. There's many, many times where we see certain findings in an eye exam in the patient's retina where we see certain types of bleeding from blood vessel damage that looks exactly like diabetes. You pull the microscope back and you say, do you have diabetes? No, I don't have diabetes. When was the last time you had your blood sugar checked? When was the last time you went to the doctor? I don't need that. I don't need to go to the doctor. I feel fine. You get blood work and he has full-blown diabetes that you saw from the eye exam. A lot of the blood-borne diseases, leukemia, lymphoma, diabetes, hypertension, cholesterol, all of those are vascular diseases, right? In blood problems in blood vessels. And you can see those blood vessels in the eyes. And so not every time, you can't detect all of those diseases from every eye exam. But if they're bad enough to affect their eyes, they're bad enough to be affecting a lot of other organs. But the eyes are clear, the eyes are visible, and you can see it. And so it's a very nice way to screen for a lot of things.
Interesting.
Yeah. It's one of the things that I like the most about the profession, I think, is linking it to whole body problems. You know, it's a rewarding profession because people come to you for various reasons, but they typically come to you because their vision is blurry and you're able to give them glasses or contacts and correct their vision and correct their complaint that same day, and they leave happy. And that's very rewarding, I think, as a clinician to make someone happy that same day, as opposed to give them a pill that will save their life, you know, an anti-cholesterol pill or a blood pressure pill. That will save their life, but it'll save it 30 years down the road or 40 years down the road. And that's obviously very important, but it's nice to be able to help someone out that same day. But it's also nice to have a link, and you're not so just in your one lane for your one organ. It's nice to be involved in an organ that has links to the whole rest of the body, and it keeps you on your toes.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.